Welcome to this continuing series of Introduction to Professional Counseling. And in this stride, we shall be looking at the process of counseling. This is where the real work begins. It is my hope that you are already updated in the theoretical background of counseling, the theories. You are already aware about the skills, and this is where we now marry everything, using our skills, using our theoretical orientations. We now get into the real process of counseling, and we shall be looking at the stages of counseling. And at the beginning here, I must say that when we talk of a process of counseling, it doesn't necessarily mean that we shall move from A to B in real life, in reality. Sometimes you may find yourself after doing the introductions that the counseling process begins. And therefore, creativity, being aware of the real world out there will help you in how you apply the skills, how the theories will guide you even as you do your work. And therefore, welcome to this session, and it's my hope that you will learn as much as possible. Continue reading widely even on the other areas that you need to in order to become a proficient professional counselor, an ethical counselor, an ethical therapist, someone well grounded with a theoretical orientation. And when I talk about a theoretical orientation, is the theories you have so far covered in other units is what guides you in trying to unravel the world of humanity and the issues that oftentimes will present in counseling. Welcome. The stages or process of counseling. Saying that counseling can be described as a process. In counseling, there is a progressive movement toward an ultimate conclusion, that conclusion being the resolution of whatever precipitated the need for help. And by this we are saying, what brought your client to seek help? What was the issue at hand? What was the need? What was the challenge? What was the underlying and presenting issues? And therefore, for you as a professional counselor, there is the desire that the whole interaction, the meeting between yourself and your client, will come to an ultimate conclusion in which the client will have a way out of the issues that could be bothering for the time. The counseling process is a planned and structured dialogue between client and the counselor. At time we meet, at time we get into dialogue, and everything about it follows certain parameters. And therefore, the counseling process requires patience and is very collaborative. It requires interaction and commitment from you, the counselor, and the client. And maybe before we even move far, imagine yourself receiving a visitor who is coming to spend the night in your house, what we normally call sleepovers. How do you welcome this visitor? And you know, the welcome includes the preparation you made even before the visitor arrived. They had made a commitment that they were going to come for a sleepover. So even before they show up, you have gone ahead and prepared the room they will spend. You have even prepared a menu, what you will share together for the meal, the evening, the breakfast. Probably you are even prepared in your mind about some of the areas you may discuss. And therefore, even before you receive your client, prior preparation Where are they coming? Is it a conducive environment? How are you gonna receive them? And therefore, imagine where you have a client for 5 sessions. Just take time and reflect on what you would do in each session. Session 1, Session 2, Session 3, Session 4, Session 5, and I'm just using a minimum number of sessions because the recommended numbers of sessions usually will range from 5 to 10, and therefore I'm just using these 5 as an example for the purposes of this class. How will you be prepared? Because if you're not prepared, you'll find that after 20 minutes you are hanging out and you get stuck with the client. You don't know what to discuss, and you may find yourself discussing the weather. You may find yourself discussing the food you ate last night, but this is not what brought your client for the session. And therefore, prior preparation is very, very important. The stages of counseling follows what we are seeing on the slide. At the first level is the relationship building, where we do the initial disclosure. At stage 2 is the assessment and diagnosis, in-depth exploration. And oftentimes in many texts you'll find these described as exploration stage. Then stage 3 is formulation of counseling goals, and in some texts you'll find these being described as understanding, moving all the way to the commitment to an action stage. Stage 4 is the intervention and problem solving. This is where we come up together, because we said this is an interactive process. We come up with right interventions and the way forward in the client's life. Then stage 5, we have termination and follow-up. At the very first beginning, we talk of building the relationship. And in building relationship, these oftentimes will be about the greetings, the rapport building, making sure that the environment is conducive, and generally having the client feel at peace and at home. The core conditions that we have for counseling, and which comes in very, very handy at this stage, is what Carl Rogers call empathetic understanding, unconditional positive regard, and congruence. We have looked at empathy as a skill in other sessions, but I may say this for those probably watching this for the first time. Empathy is conceptualizing the world of your client, imagining how they are feeling, imagining what they are going through, because it's never the counselor's experience, it is the client's experience. Hearing their world and conceptualizing it and imagining how that world is. Unconditional positive regard is about lack of judgment. You receive the clients as they are. Sometimes within Christian circles, and for us in our class here, we find that oftentimes there is the tendency to classify people as deserving of grace and those not deserving. You know, putting people in straight jackets of this is a sinner and this is not a sinner. Unconditional positive regard is the call of Christ for us in the church. Come to me as you are, and I'll give you rest. Without judgment. Congruence is about presenting yourself in such a manner that the client is able to flow with you. CACAF adds to these core conditions the aspect of respect. You know, respecting our clients regardless of where they are coming from and how they bear themselves. I am reminded about the washing of the feet of the disciples during the Last Supper, in which Christ the King bows down to the level of a servant and washes the disciples' feet, something that was traditionally reserved for servants within the Jewish community. And you can imagine the dusty feet. You can imagine some of them could have been smelly for having walked long during the day. But Jesus assumes the level of a servant. And without judging them, respecting them for who they were, creations of his Father, he does the washing of the feet of the disciples. And this is the call every other counselor is called upon to respect, so that the client is able to feel at home. Confrontation, which CACAF talks about, is not the actual meaning of the word in the English term. Confrontation is about pointing out to discrepancies that could be there in speech, in behavior, in language. You know, gentle confrontation where the client comes, we call this client X, and they are talking and they say, my spouse is very uncaring. I don't know how I settled for this particular spouse. Then in the next sentence they say, but the beautiful gold chain I'm putting on was brought to me by this same spouse. So gentle confrontation is, you say your spouse is uncaring, yet he or she remembered to buy you a gold chain. Immediacy is about talking about the here and now things during therapy. It helps to bring focus during therapy. Immediacy helps us in the interaction with our clients to actually focus on the immediate things. Concreteness is about going to the point. Self-disclosure, which we have covered extensively in other units, but which I also here mention in passing, is about allowing the client into your world, the therapist, making appropriate disclosures about his or her life. You know, once in a while during therapy, because of the interaction of what is happening and what is shared, the therapist may find himself or herself breaking down because of the triggers from the story of the client. Self-disclosure is when you pause and say, when you talk about the death of your spouse, when you talk about the death of your mother or your father, it reminds me how sad I felt when I lost my own father. it was devastating for me. I can only imagine how you're also feeling. This is where you let the client know, I am human. I broke down during my time of crisis, and therefore I hear where you're also coming from. But you must be careful to let the client know that your tears are not because of her tears. It's only that the tears triggered this particular episode, and therefore you are careful to appropriately allow the client into your world. The quality of the therapeutic relationship that should form at this very beginning could be affected by some of the following factors: your personality and professional quality. How well have you prepared yourself in the professional world? How is your personality? And then another thing that may affect this is the client who sits before you, their interpersonal history and the anxiety state. How has their life been? What hurts and wounds are they bringing to therapy? Then another thing that may affect this interaction is the client's previous experience with sharing personal information, interaction with authority figures, with older persons, and with the opposite sex. What scar could they be carrying out of all these interactions? And therefore for you, the therapist, or you, the counselor, it is paramount to re-examine some of the following: transparency, being careful not to transfer your feelings or desires to another person, or being careful that the client doesn't transfer their feelings to you, because you'll find that a client associates certain fictional qualities with the counselor. And by fictional qualities, we are saying this client seated before you could be seeing in you the nurturing mother. They could be seeing the demanding boss. They could be seeing an arrogant colleague, and therefore either act either negatively or positively toward you. Remember, you are the professional therapist. You are the professional counselor. At all times, present yourself as a professional, and whenever you perceive that this client could be seeing some of these associations in you, kindly explore it and bring it to a conclusion. Counter-transparency is where the therapist or the counselor now transfers or associate fictional qualities with the client. This is already client seated before you. They are going through a divorce, and you are a man therapist, and your relationship is not doing well at home. So as the radio opens up, your mind is going like, oh my, this man is throwing away this wonderful, beautiful lady. And before you know, you are transferring your feelings to her. We usually say, take care of your needs first before engaging with a client. And therefore, you need to be aware and recognize all the psychological dynamics, interpersonal assumptions, and all the emotions that could affect the relationship building. A skillful counselor should develop a self-congruent style for meeting clients, and you should at all times be careful about your personal qualities and counseling experiences you hold so that they guide the interactions in therapy. Some of the social skills in creating rapport include the need to introduce yourself, the need to hear the client's name and remember it, remembering to invite the client to sit down, and seeing that they are reasonably comfortable. Always address the client by name. If your client is highly anxious, engage them in some initial social conversation and watch to see if the anxiety begins to dissipate or to go down. Be watchful of the non-verbal behavior and use that information to try to understand the client's emotional state. Invite the client to describe his or her reason for coming to talk to you. Allow the client time to respond. Do not interrupt the client or finish up their sentences for them. Use attending and listening skills to move the process along. Being careful that there is need for interpersonal interaction, being trustworthy, competent, and sensitive to the needs of your client, an awareness of the cultural factors in oneself and others. And these cultural factors will also include the religious factors. When your client probably is somebody who uses alcohol, and you are this good Christian brother or sister, when they come smelling like they slept in a brewery somewhere, how do you receive them? Do you start biting the alcohol spirit in them, or do you see an individual worth of the care and love of God, of the care and attention of professional attendants from you, the professional therapist? The other thing that follows is the problem assessment and diagnosis. Basically, this is about what brought the client to seek therapy. This will involve the collecting and classification of information related to the client's reason for seeking counseling. It entails gathering information by completion of intake or clinical interview. And therefore, there is need to reorient yourself with the intake form. There is need to reorient yourself with the clinical interview. This is a time to promote understanding of clients' situations and perspective. At the back of your mind, you keep asking yourself, why is this client before me? The counselor may use the non-standardized clinical interview tools or standardized tools like psychological tests for risk assessment or formulation of appropriate diagnosis. There are many tools out there in the market to help you do the problem assessment. This is a time for you to carefully listen and draw out information regarding the client's situation. Understanding of their life, an understanding of their work, what they do, their home, their education, and the reason they have engaged in counseling. For instance, they could be going through a marriage issue in life. What does this mean for them? They could be challenged because of having an uncaring boss. The home, the children care, the issue of nannies and the like. They could also be going through an evening class. And therefore, what does this exactly mean for them? And why are they before you to receive this therapy. And therefore, all the information crucial to the other subsequent stages of counseling oftentimes happen at this stage. Identifying their needs, agreeing on the timing, identifying the environmental factors, the stress levels, and other contributing factors in the story of the client who sits before you. This is a time for correcting information, what we are calling data correcting time. At this time, open up your communication channels to receive information that the client is communicating. And the client's problem may be conceptualized in the following ways. By conceptualizing, we mean the client's problem may be understood in the following ways. Number one, what brought your client could be needs in his or her life. Something is missing in my life and its absence is disturbing the natural flow of life forces. And this could be why this client sought for help. Number two, stressors in his or her life. Something unpleasant has entered my life and its presence is producing distress and distraction. Going through a difficult moment, it could be economic, it could be marriage related, it could be about work situation, it could be environmental, the neighborhood becoming such an issue, etc. Number three, misinterpretations. The way I am thinking about my life limits and my alternatives. Sometimes people feel like they have come to the end of their rope. Sometimes people think it has all ended and life no longer makes or provides any meaning. And of course, for us in therapy, we understand this could be about misinterpreting things or misinterpretations because of having sometimes a one focus kind of approach. Number four could be about maladaptive interpersonal patterns. Where somebody thinks I'm a better person with some people than I am with others. Keeping on comparing ourselves to those others. And in therapy, it's time we help our clients see that everyone is fearfully and wonderfully made. You matter. You may not matter to everybody else in this world, but if you look critically and keenly, somewhere, someone cares for you. Number five, the client may come because of a combination of needs. Combination of stressors, combination of misinterpretations, and the maladaptive interpersonal patterns. And most of the times, the client will have multiple issues. And therefore, as we engage in therapy, our work as therapists is to help them focus, and agree on the first things first. Problems can be classified as affective, that is, problems with emotional sources. They could be classified as behavioral, that could do with undesirable behavior. Problems could also be classified as cognitive, in which case we are talking of the mind misrepresenting the reality of the moment. Problem could be systemic, to do with systems, to do with contextual contingencies, and the client may present with all of them. Your work, my work as a therapist, as a counselor, is to keep asking ourselves, what do I do with each of these classifications? The skills needed in assessment include the skill of observation, and here is where we take notice of the client's general state of anxiety or comfort. We also take into effect the gestures, the movements that suggest either emotional or physical dysfunctions. We also observing the manners in which the client frames or alludes to his or her problems. Some tend to diminish while others tend to inflate their problems. There is a tendency with us as human beings sometimes to over-present our issues. And we think the world must be ending in the next one moment. Sometimes we do minimize, where we say, anyway, it doesn't matter, it's not major. And the person who is saying it's not major is already presenting with traumatic wounds, physical, received in a domestic violence setting. And they are actually saying it doesn't matter. You are also observing for verbal and nonverbal patterns. Another skill that is needed in assessment is the skill of inquiry. It entails asking for the fine points, the details of information that provides the meaning to the problem. And some of the issues to know, this is in the initial history taking as we even move with assessment. You're asking about their client's health. Because is it a health issue that brought them? And then probably part of the client's health, like a chronic condition, could be what has brought the counseling concern. They are feeling that life doesn't matter any longer because they have received a diagnosis of a chronic condition like CA or cancer. Then are they on medication? And this is where some retro exposure to some of the medications used out there, keeping a tab with a few doctors and nurses there, so that when somebody tells you they are on antidepressant, you very quickly know some of the counseling concerns that could come up because of the use of antidepressants. You are also aware that antidepressants are being used by somebody going through depression. And therefore, what is your input? What is your coming in as a therapist? You are also inquiring about feelings of despair and depression. You are also assessing for self-destructive thoughts. And this is where we check for suicidal ideations. Is this person likely to self-harm themselves? And what is the implication of this for you as a therapist? Because somebody with suicidal ideations, with tendencies for self-harm, of course, when it comes to the issue of confidentiality, the confidentiality is limited to the extent that you may share with somebody close to them about what they are going through so that they may not self-harm themselves. You are also inquiring about, are they going through any interpersonal conflicts. And then as you do this, you're also recording facts. On a notebook next to you. Let me say that the recording of information is a very disciplined process. It is not always done systematically and promptly. Sorry for that. If it is not done systematically and promptly, it could be lost and therefore useless. You can record as counseling is going on, videotape, and anytime you tape your client before you engage the taping, you are required to obtain consent for recording them. Usually pen and paper is the best recommended method, but even as you do this, be careful that your mind is not lost in the recording or the writing down, because your focus should always be on the client. With time, develop shorthand so that you are able to note some of these points as quickly as possible. You're also making association among facts and forming a hypothesis. By forming a hypothesis, we are saying here, you are starting to imagine what could be the likely issue, what could be the likely solution, what could be the likely process this person is going through. As you gather the data, as you go through them to try and identify associational patterns necessary for the counseling case at hand, you are making educated guesses on the cause of the problem at hand. You are listening and listening with understanding in mind. Finally, for you the counselor, you have to ask the client what the problem is. These simple questions yield the most important information, the most accurate insights of the entire process. What brings you here? But even as you are asking this question, you have been listening all along and you have been making educated guesses. So even as they tell you the problem, the professional you, the astute you, the keen therapist that you are and are becoming, you are already telling or imagining, telling yourself or imagining this could be the issue. And this is where we distinguish from the story we have had and what the client says the problem, whether the presenting problem is the underlying problem. What follows next is the formulation of the counseling goals. The act of setting a goal involves the client articulating where they want their counseling journey to take them by making a commitment to a set of conditions, a course of action, or an outcome. If somebody is moving from town A and their destination is town Z, they are already having a destination in mind. Did the client come with likely solutions and the way forward? Setting goals can also give the therapist a better grasp of client growth as they proceed with therapy. At this level, remember we talked about a collaborative process. We are asking our clients, what do you want to achieve by coming to see me? You are setting the goals together. And the importance of setting goals includes, it enhances a sense of ownership and motivation. This is where the client is literally saying, this is my issue. And my hope, my desire, my prayer is to end in this manner at the end of it all. Factors which are important in the change process. Because with ownership comes more commitment of the outcome. Number two, it helps know how well counseling is working and when counseling should be concluded. As you achieve every other goal you agree upon, you know you are making progress. Setting goals also help the client carry responsibility and avoid the dependency tendency. Remember, it's never about you, the therapist. It's about the client. This is their issue. This is their challenge. This is their journey. Don't walk the journey for them. Because sometimes you are very suggestive of the way forward. Let it come from the client. Ours is to aid the journey to progress. Another importance of setting goals is the client is involved, so they have an intense experience in the problem and its history, the potential insight and awareness of personal investment in change. They literally know where the shoe pinches. And therefore, as you sit, you are helping them to readjust the way they put on their shoes. But of course, the action of adjusting is their responsibility. Remember, ladies and gentlemen, goals may change. They may evolve as therapy progresses. And therefore, in subsequent sessions, it is always recommended continue reviewing the goals and seeing, are we making progress, and should we work toward a change in a certain area. And some of the goals we may agree together with our clients include: number one, to change an unwanted or unwelcome behavior. Somebody probably is in drugs and substances, and this is where the client says, my desire is to stop drinking. Number two is about helping them to better cope. Empowerment. Somebody is working in an environment they feel so very oppressive, but yet they love their job. So what is this that they are going to work on so that they better cope in the environment, as long as staying there is not causing them harm? And this includes in the issue of marriage, family dynamics, environmental, neighborhood issues. How do we help our clients to better cope without necessarily moving away? And then, when is the time that they may be needed to actually move? Number three, another category of counseling goals includes to make and implement decisions. Some people feel stuck. This job is literally killing you every other day. The end result of sticking in this marriage is death because of domestic violence. But somebody is they are saying, but what can I do about this? Yet they say they are thinking like A, B, C, D. So a goal of counseling here is helping them to make and implement decisions. Another counseling goal is about enhancing relationships, to live better with those others, to improve the way we relate with those others. And another goal includes to help the client's journey of growth toward achieving potential. In our Kenyan situation, some people may have stopped at the secondary school level of education because of finances. They got married, they married, and they are there thinking it is the end of it all. But something inside them, some inside so strong, keep on reminding them, I can do something. How does now the client assume a continued journey of growth so that they meet their full potential? Going back to school, night classes, online classes, a business they are just doing within their compound. How do we help them, by getting inside of themselves to mine their full potential? Because each one of us has been blessed with potential. And like the waters we drill down there, how do we help them see the drills, the kits, so that they may get the very sweetest of the waters and achieve their potential? The skills used in setting goals may be divided into 3 classes. Number 1, the counselor's inferential skills. Making inferences. What could this be meaning? When my clients say ABC, exactly what is this that they could meaning? And this comes through listening to the client and deciding and hearing the real desire in your client. Number 2, differentiation between the ultimate goals, the intermediate goals, and the immediate goals. Intermediate goals and immediate goals provide the strategies necessary to accomplish the ultimate goals and the real vehicle for change in counseling. We have the very end, the ultimate goals. But before we get to the goals, they are the here and now issues, what we call intermediate. Sometimes dealing with issues of like, how early do I wake up? And I want probably to be going to early morning class. And then the immediate goals. How do I get the fees to pay for my night classes? Being careful that once we work towards the intermediate goals and the immediate goals, we'll be in a position to maximize on getting to the ultimate goals. What we call dealing with the small foxes, so that finally the plantation will yield the fullness of the harvest. Number 3, teaching the client how to think realistically in intermediate times. What do I need to do in the here and now? How do I deal with my tendency to procrastinate, to delay things? There are those times, even for me, I wake up in the morning and I feel energized. But you just cannot sit. You have to push yourself to the next. So how do we help our clients to deal with these intermediate terms? Help the client to set goals that are attainable. Start by setting the alarm for 6:30. If your issue is waking up early, then the next week for 6. Slowly by slowly, you find yourself coming to 5 a.m. It is a slow process, but then help them to work with goals that are attainable. Because you just cannot move somebody who's used to waking up at 8 a.m. straight away, move them to 5 a.m. It may even shake and mess with their sleeping habits. You don't just move somebody who has been eating, just 3 meals in a day, all of a sudden you put them on breakfast and you tell them they survive. Let it be gradual. And some of the ultimate goals may include graduating from college, getting a promotion. The intermediate goal could be, in the next 3 months, towards my graduation from college, I will make sure that I check whether I have done all the necessary units and check with my department for the same. The immediate goal, the here and now, tomorrow morning, I am going to go to college and I'm going to sit with my academic advisor so that I get to know what is remaining for my graduation. And in this way, we are having progress towards the final goal. The immediate and intermediate goals provide the strategies necessary to accomplish the ultimate goals and are the real vehicle for change in the life of your client. So far, I believe we are doing well, and probably it is time to just take a moment and pause and ask ourselves, how are we moving on? We then move to the intervention and problem solving. This is the action taken to achieve the set goals. In this process, the clients become involved in order to improve the quality of their life. It helps initiate and facilitate desirable change. The client answers questions like, what can I do to solve my problem? How do I make it happen? The problem could be desire to buy a car, and therefore what do I do to get this car? How do I make it happen? The counselor acts as an agent of change by facilitating the process in which the client envisions a better future. You are helping your client to imagine a future better than what they are going through. A future in which they shall not be lining up at the bus stop, a future in which they shall not get rained on because they'll be having a car, a future in which they shall be able to achieve much more in one single day because they are able to move from point A to B in the shortest time possible because of owning a new car. But towards this, you're also helping them set realistic goals and decide on methods to achieve them. The first car, dependent on the salary or the income, how do you go about it? Usually, you just cannot go to a fuel guzzler right at the beginning if the income could be a challenge. So how do we progressively move on? Do you get a loan to purchase a vehicle in which the repayment period is the next 5 years? And the repayment sums leaves you with very little to use on the daily living. Realistic goals. How do I get a car, manage it, and still manage my life? Intervention and problem solving also include choosing the right intervention. Not all interventions work with all clients, all as one might predict. A could work for client Y, B may only work for client Z, and therefore help them choose the right intervention. Be prepared to change or modify intervention strategies when all is not working. Sometimes there is need to reevaluate how the problem is defined. Exactly what is the problem? In a marriage issue, is the problem the domestic abuse, or is the problem the tendency for dependency, in which this lady feels, without this man I'm dead, and therefore whatever he does I'll accept because he's my oxygen, he's my food, he's my everything, and therefore they sit there and they actually encourage, they become a enabler to what they are going through in this relationship. So is the problem the man? Is the problem the lady? And therefore we need to continue reviewing and evaluating the problem. The intervention process entails: ask your client what solutions or remedies they have tried. How else have they gone about this? If it is a health problem, the doctors will usually ask, have you sought help from another doctor in the past? What medications have you used? For counseling issues, you're asking, have you seen another therapist in the recent past? What have you done about this? Then you relate problems to interventions depending on the character of the problem. Even as you talk, even as you engage, you try to relate this particular issue to how it can be solved. And by here we are talking about cognitively determined problems. That is how the client view life cognitive changes. In their mind, what do they think of this issue? Social, family, work, friends. Help them look at altering the interdependent social systems. Where we become so interdependent. Developing an independence so that they are able to stand on their own. We are also listening at the problem coached in terms of hurt, sadness or anger, and what are the remedies? Tried effective disclosure and exploration. How do you feel about this? How else can you handle this? Then we have behavioral problems related to client's action or effort to affect others. How do we, and this is the client we are asking, how do we, or how do they relate to those others? Choose the right intervention for each. And then we are also looking at the skills related to initiating interventions. And this could include competency in using a specific intervention, and this is about a theoretical intervention, knowledge of appropriate uses of specific interventions, and these develop with time, with continued counseling, therapeutic work. With time you develop different skills and knowledge of specific interventions. Then you're also knowledgeable about typical responses to that type of intervention. So if we try A, how is it likely to be? And the observational skills related to the client's response to the intervention. Always keep observant. Ladies and gentlemen, as I have been alluding, the issue of theories and therapies. From our theoretic orientation, the theories now comes in handy in the way we help our clients work on their issues. The therapy or mode of treatment is drawn from the theories, concepts explaining a particular phenomenon. Different counseling theories have different viewpoints with what a good counselor should do. For example, a person-centered therapy, here the counselor involves rather than intervenes. The client is the most important aspect. And in person-centered therapy, everything we do is about the client. And therefore, there is a place for a relationship and engaging the client's self-actualizing tendency. You are exploring, that the answer is within themselves because they are made or they are created with a self-actualizing tendency. It is not the therapist who holds the answers. Existential therapy is about encouraging the clients to recognize and assume personal responsibility for their choices. Yes, the responsibility towards change is with the client. Existential therapies, Roro May and others, Fritz Perls, help the client or encourage the client to recognize and assume personal responsibility. Some of our clients will come and the story is those others. My husband, my wife, my boss, my priest, my neighbor. And walking along with the victim mentality. And the critical concern, and I think this is one African saying, that when you make yourself a carpet, people will definitely walk on you. The responsibility is to remove yourself from being a carpet. Behavioral therapy focuses on activities designed to help the client alter their behavior and manage personal contingencies, both in counseling sessions and in the client's real world. This is about changing behavior. Sometimes we talk about food being the problem, but check critically. When is the last moment you sat down and this piece of meat jumped from the fridge, put itself in the cooking pot, and before you knew, it was shoving itself inside our mouths? We are blaming food when we needed to change our behavior about how we treat food. Cognitive therapy focuses on conditions that invite cognitive dissonance and disrupt static cognitive states. The way we think and we view things, sometimes it is the long thinking approach, and therefore we need to change our thinking so that we are able to be reoriented in our present circumstances. Then systematic therapy challenges interpersonal rules or interrupting systems that probably may impede our movement. And the skills related to initiating intervention, competence in using a specific intervention, for example, the empty chair technique, the dream analysis. From our theoretical intervention, we remember the empty chair technique, in which somebody going through a bitter experience, they are feeling hard because of this particular person. You invite them in therapy and you place this empty chair before them and you tell them, imagine so-and-so is seated here. What conversation would you hold with this? What would you talk about? What would you tell him or her? Then, of course, dream analysis from psychoanalysis. in order to intervene on a few issues. The knowledge of its effects does it all. For example, it provides access to hidden and possibly frightening feelings. Like when we use the empty chair, we are telling them without reservation, open up your mind. The ability to read clients' reactions such as normal versus abnormal reaction or an unpredictable response. As we sit with them in therapy, as they engage in this empty chair, are we able to read their reactions? And then we are getting towards the final process, the evaluation, termination, or possibly referral. A counseling session is often terminated naturally without much prompting or planning. Before termination, it is important to summarize meaningfully, to reiterate the plan of action, to clarify referrals if necessary, and to dialogue follow-up sessions. Evaluation focuses on generating hypotheses, and this is, what is this issue? Or what did I think about this issue? Then, what interventions did we try? Determining whether the goal is met, a plan for evaluation with your client. And then, probably by session 8, 9, we are looking at termination. And termination is when we bring our relationship to an end, and the client is released to go back to their normal lifestyles, hopefully better off than they came. The counselor needs collaboration with the client in identifying a date in advance. During the 8th session, you may agree that by the time you get to the 10th session, that is the time you'll do termination. Review progress. Create closure in client-counselor relationship and plan for the future. Have we achieved progress? Has the issue been brought to a closure? Is the client well empowered? And how further can we empower them? And this is very, very important. Termination should not just be done without careful consideration of the progress made. It is the end of therapy, and sometimes termination can be done by referring your client to somebody else. You realize that this is not my client. They could be needing medical attention other than what my training is in, and therefore for a concern like medical attention, appropriate referral to a medical personnel. A psychiatric issue in which this person may need prescription for certain drugs. When you do your assessment and you realize this is not your client, then you refer them. And a professional counselor, professional therapist, referral is one way of yourself acknowledging, I am professional enough not to harm my client by insisting to be with them when I know I'm not helping them. So referral is a professional mark that says, I am an expert in my field, and therefore I can give this work to somebody else. And finally, ladies and gentlemen, I want to give an activity. A distressed woman makes an appointment to see you. Immediately she enters the room, she bursts into tears and says, he has left me, and I just don't know what to do. I feel so lonely, and the children are upset. What do you think I should do? Illustrate how you would use the stages of counseling as you counsel the distressed woman. And this will be marked out of 20 marks. Enjoy your week. Enjoy your day. Be blessed. Thank you. Thank you for listening.